Too many details there. Let's kind of break this down in a bunch of bite-sized chunks if we could, okay? So let's go back and do a little flashback as to how we started down this path. Now, I'm not going to go back into the whole history, the last 2 decades. I'm just going to talk about recent history when it comes to the Affordable Care Act. This was the stated objective of the Affordable Care Act, right? Lower costs, expand access to care, and improve the quality of care, and protect consumer choice, right? How many of you guys heard that as a stated objective? All right, so as a very conservative Republican, I 100% agree with this stated objective. I have no problem with this. This is something I'm very concerned about as well. The only problem is, this is what we got in response to that objective. And this is a little copy over here. Now, this isn't just put up there for drama purposes, folks. Each one of these dots corresponds to a section in this little binder over here, or not so little binder. This right here, in case you're curious, is the actual Affordable Care Act. This is HR 3590. Mine's got a lot of dog ears in it because I've gone off and read it. I'm one of the few oddballs that actually have read the Affordable Care Act. I didn't vote on it. I was in the state legislature, not in the federal legislature, but we're impacted directly by it here in the state. We've had a couple of key decision points from a legislation perspective here in the state of Michigan, and they dealt with a couple of our circles here. One is on Medicaid expansion. The other is on the concept of a government health exchange. You guys are both familiar with both these concepts, I'm assuming, right? We're going to go into this in a little bit of detail. Michigan did end up, just so you know, a little bit of status on it. Michigan ended up pursuing Medicaid expansion, which essentially expanded access to health care for people up to 133% of the federal poverty level, which is sitting around $11,200 or so, which makes sense. We want to have a safety net in our country for people who can't afford care, right? The key is how to provide that safety net. And the other one comes down to government-run exchanges. Michigan opted out of a state-based exchange, and by default, we pursue a federal exchange, and that's a good thing. And I'll kind of highlight that and say why that's such a good thing. So, give you a little bit of update. The status of different exchanges across the country here. Essentially about 36 or 33 or 36, I can't remember the last count, it's tough because there's different flavors of this across the board, have decided to pursue federal exchanges. Very few have decided to pursue state-based exchanges. In regards to Medicaid expansion, quite a few more states actually pursued Medicaid expansion. And for one simple reason, the federal government promised for the first 3 years to give you 100% coverage of that expansion population. After that, all bets are off, and there's an increasing share of that cost that's going to be absorbed by the state government in order to provide that assistance. So, quick summary of Michigan status. We fought the state-based exchange, we fought the state partnership exchange as it's talked about. There was some initial seed money to go off and investigate that in the state of Michigan, but those were pushed away as well. On Medicaid expansion, they ended up pursuing House Bill 4714, which was they call it Healthy Michigan as well. And there's something else we're going to be talking about today, which